Okay, so this session is recorded to be shared also to your other colleagues that needs to learn on this topic. Now, we landed on the topic that differentiates human acts and acts of man. If you would look at ethics or the study of ethics, our main focus is the human acts. So take note, class, that we are differentiating on the term human acts and then acts of man. And then our purpose in ethics in nursing is for us to identify whether the human acts is ethical or not. Okay, so the main purpose while we are learning ethics in nursing is for us to know whether the human acts are ethical or not. So if you will be asked if what is the focus of the study of ethics, it is the human acts and not the natural acts of man. Now, if there is one way for you to differentiate a human act from a natural act of man, these are the key words that you need to remember. When I say, class, that it is a human act, meaning it is conscious. Okay, meaning it is conscious. You did it according to your own will. You did it without forced by the others. You did it without the influence of others. You did it on your own. That's what we call human acts. But when I say, class, natural acts of man, when I say or use the term natural acts of man, or even just the phrase acts of man, this would mean, guys, that these are unconscious. These are unconscious. And commonly, class, this is done with force. Okay, for example, I hit somebody because I acted upon self-defense. That's considered to be a natural act of man. Okay, another keyword perhaps that could help you differentiate this is that a human act is considered to be voluntary. For example, I'm talking to you right now. Nobody is forcing me to do so. That is an example of a human act. But then if somebody is forcing me or somebody is pointing a gun at me and then telling me, hey, you need to do the lessons in ethics or else I will kill you, that would mean natural acts of man because it's already involuntary. I'm under coercion when I did it. Okay, and again, when I will ask you, what is the focus of ethics? It is to learn the human acts, to understand the human acts, and to determine whether this human act is good or bad. Okay, that's the purpose. Okay, that's the purpose that we would want to have ethics on. Now, to continue, class, these are the examples of acts that are not morally accountable. For example, acts of persons who are asleep or who are under hypnosis. I don't know if you're familiar with hypnosis, but class, in hypnosis, there's a use of the pendulum. Commonly, they use the pendulum, and then it would render the individual to be unconscious. So somehow you can say that hypnosis is a mind control technique. Okay, your hypnosis, class, is a mind control technique. Now, if you are under the influence of hypnosis, I could not blame you. You could not be blamed if you have done something because after all, you are under the influence of hypnosis. Next, reflex action where the will has no time to intervene. What do I mean by that? When I say reflex action, let's picture a situation that somebody approached you and then that person is about to click the gun. It's about to press the gun and then about to point the gun to you. And then you suddenly pick up a knife and then throw it to that person. Without knowledge, you accidentally killed that person. Class, you could not be held morally accountable because you acted under self-defense. You acted under self-defense. And when you acted under self-defense, class, now when you acted under self-defense, you could not be held accountable for that mistake. Then acts performed under serious physical violence. What do I mean by that? For example, you are a hostage and then you are asked, you need to do this or else I will kill you. For example, they will say that you need to do this, you need to pretend this and this or else your head would explode. Okay? Now, if ever you've done anything stupid during that instance, if ever you've done something illegal during that instance, you could not be held easily liable in court. Okay? Why? You acted still without your own voluntarism. You acted without voluntarism. You acted, class, under the influence of force. Okay? And as I have mentioned, once the will is constrained, it is not a normal act which could be evaluated. In other words, if you were not given the opportunity to decide, if you were not given the opportunity to choose, you are coerced. In our language, pinilit ka lang gawin yan. Okay? Pinilit ka lang. Hence, class, you cannot be held morally accountable. Now, why do we need to study the human acts? As I have mentioned earlier, the focus of our study is your human acts. And when I say human acts, class, there is responsibility, there is accountability that comes with it. Okay, again, class, when I say human acts, there is responsibility and accountability that comes with it. And ethics is the field of philosophy that specifically studies human acts in the light of morality. Okay, so class, it is the human acts that is the center of our interest. Okay, it's the human acts that's the center of our interest. Now, in learning ethics, one can be reminded of the word of Socrates. Okay, class, remember Socrates, one of the great philosophers? So class, Socrates has mentioned that the unexamined life is not worth living. If you would apply Socrates' messages, if you would apply Socrates' message at the present time, class, that might actually mean that, okay, if you are unable to reflect with your life, if you are unable to realize who you are, it's very difficult for you to live. Okay, it's very difficult for you to live. Now, if you would go back to your lessons class in health assessment, no? For example, if you would go back in your lessons in health assessment, if you are interviewing somebody who is an abused, okay, let's say, for example, you are interviewing a patient who is an abuse victim. Okay, if you are interviewing a patient who is an abuse victim, what do you think will you do first? A, class, will you clean the wound of that patient? And then B, assess self-values. Letter C, refer to the physician. What do you think would be the best response? If those are the choices, let's say, for example, you are about to interview a patient who is an abused patient. What would you do first? A, B, or C?
B, sir.
How about others?
A, sir.
Okay, class, it goes back to letter B. It goes back to letter B. Okay, some of you might be answering, how about, sir, the wound? Class, if you would look at the term, it says the wound, meaning it is not really life-threatening. It is not an open wound. There is no mention there that the wound is fresh. Okay, so A is not a good answer. Why class B, class? Here's an example. For example, you're dealing with a patient who is an abused victim, and you turned out yourself to be also a victim of abuse. If that's the case, class, you will not be therapeutic to your patient. Okay, you will not be therapeutic to your patient. Why? By the time that the patient will be sharing about abuse, you might be the one that will be affected by the sharing of the patient. Okay, now, for that reason, class, Socrates is telling us that we should keep on examining our own life. Okay, so class, an unexamined life is not worth living, according to him. So class, you can equate that to your moments of self-reflection. You can equate that to the moments of self-reflection. Okay, now, let's see. What are the ethical dilemmas or moral distress? This has been constantly repeated since the day one of the discussion. Here are, class, the keywords that you might want to remember. The person knows the right way of performing a task or performing something, but does not have the organization, but the organizational limits would make the execution possible. Okay? In the earlier part of your textbook, it is actually defined as this. It is defined as knowing what is right, but being unable to do so. That leads to your ethical dilemma or moral distress. Now, what do I mean by that? For example, I know that my patient deserves this. For example, I know that my patient deserves this type of care. Okay? However, when I will approach the patient has no money. Or worse, our patient could not be accommodated in the hospital because the hospital has no facility. Okay? So those are the things that you need to consider. Now, sometimes it's just easy for you to say that, okay, let's do this because this is what's best for my patient. But then you will come to realize, okay, there's no supply. Okay, there's no stocks. Okay, I could not do anything about it. And that places you on an ethical dilemma. That's why it's referred to as an ethical dilemma. Diba, when I say dilemma, I don't know what to do. Will I be going towards A? Will I be going towards B? What would be the next step that I will do? Okay, that's moral dilemma. Okay, now let's see. I'm so sorry. I think I skipped something. Okay, we're done with that. So again, class, that's the definition of your moral dilemma. Now, let's go to the next one. Okay, Wilkinson. Class Wilkinson has defined that moral dilemma or moral distress, is experience mental imbalance and negative emotion when the individual makes an ethical decision. Look at the words. Individual makes an ethical decision but is not able to act in line with their decision. In other words, class, no? In other words, this individual class knows what is the right thing to do. However, class, that the same individual is not capable of doing it. Okay, that leads class to what you refer to as your ethical distress or moral distress. Okay, it leads to your ethical distress or moral distress, according to Wilkinson. In addition to that, dear students, Wilkinson has also advocated that it is a mental imbalance and negative emotions. Okay, mental imbalance and negative emotions. Just imagine that you are in the situation that you want to give the medicine, but then your patient does not have the budget to do so. Okay, that's leading towards your moral distress. Now, and then the sad thing pa is that as student nurses, you are being educated on what is the best thing to be done to your patient. For example, later on, you will know in MS that there are antibiotics that are best suited for this patient. And then when you will arrive in the clinical area, you will encounter people who does not have the money, okay, and who could not buy the antibiotics. So you are experiencing moral distress. Now, how can nurses assist the patients and clients? For us, class, to assist our patients and clients effectively, you need to be able to develop a sound ethical judgment. That's our goal for this semester. Then you should have a grasp of the theories, principles, guidelines, and codes. So when I say class codes, you have we have the code of ethics, for example, in nurses. There is also a code of ethics for educators. There's a code of ethics for all the profession that we have in the Philippines. So you need to be familiar of this, no? Then there should be scientific knowledge and interpersonal skills. Because without this, you are unable to advance in our profession. Now, what are examples of ethical dilemmas that we could be encountering in our setting? Now, look at this. If you have your textbook, you could read from your textbook. Okay, but I would want your attention to be on screen. Okay, I would want your attention to be on screen. I would be reading it slowly. It says there, class, a young woman asking for abortion because she is not ready for a baby and she has no job. Okay? Now, again, young woman asking for abortion because she is not ready for the baby and she has no job. As a nurse, you would believe that life is inviolable. In other words, class, I could not violate life. Okay, that's a fetus, that's life. Yet, you also understand that the young woman's predicament on raising the child and to respect her autonomy. Okay, so you are torn here. If you are the nurse, if you are the nurse in the Philippine setting, will you support the abortion of your patient or not? Will you support the abortion, class, or not support? Sige na, I would want to see on the chat box, how would you deal with this situation? Okay, somebody is approaching you, hey, nurse, mapa-abort ko ya. Okay, hindi ko kaya na palakin itong anak ko. What would be the best move for you as a nurse? Will you support the decision or not support? Sige nga, I would want to see your chats on that. It's okay, guys. There are no right or wrong answers for this one. Okay? There are no right or wrong answers for this one. Sige, not support. Somebody is saying not support, not support. Okay, not support daw. Many are saying not support. There's somebody who's saying support. Okay, first off, I would like to ask, okay, I would want to know that. I would like to ask if the woman has any possible support, family and friends. That's a good way to start. That's a good way to start, John. And then somebody is saying, yes, sir, it's the patient's choice. So oftentimes, class, those who would support here the idea of abortion are those who believe or who are strong advocate of women's rights. Diba? We have your women's rights advocate. And then class, the principle of autonomy would set in. Okay, class, what is autonomy? It is the right to self-determination. Okay, it is the right to self-determination. As mentioned here by James, I am still her rights, but I would encourage the patient not to go for abortion. Okay, Dominic here is saying, I am not in the position to deprive the woman of her bodily autonomy. Good insights, good insights. Now, class, autonomy, as I've mentioned, is the right to self-determination. So when I say class self-determination, for example, this is myself. I know what's best for me. I am the one to decide what's best for me. That's autonomy. That's what we refer to as autonomy. Now, those who will not be supportive is that those who are traditional in religious beliefs, those who strongly believe on the right of the unborn child. Plus, we have the rights of the unborn child that is enshrined legally. Rights of an unborn child. Okay? Diba? If you would look at it, it's difficult to decide. No? It's difficult to decide. Now, maybe to guide you on this, okay, let's limit. Let's say, for example, you are in the Philippine setting. Okay, you are in the Philippine setting. As of present, as of 2022, is abortion allowed in the Philippines? Sige, as of present, okay, 2022, is abortion allowed in the Philippines? Okay, let me see answers. Yes, class, it's not allowed. Again, abortion is not allowed in the Philippine setting. Okay, so if that's the question, if you are being asked in the Philippine setting, your answer, class, is that you will politely decline your patient. Okay, you will politely decline your patient. Okay, that's it. That's the best response for that. Now, however, the situation changes if you are abroad, no? The situation changes if you are abroad. And plus, oftentimes, if you are referring to Western countries, such that of the US of A, for example, you need really to give more value on the right of the individual for self-determination. You just need to make sure that the individual is already on the age of majority. When I say age of majority, what is that age? Age of majority. What age is your age of majority, guys? Sige nga, ideas lang. What age is your age of majority? When I say age of majority, what age is that in our setting? Okay, very good. 18. Very good. 18. Okay? Plus, when I say age of majority, that would simply mean that the individual is already capable of deciding for him or herself. Okay, that's your age of majority. So class, once your patient is already of age, plus age of majority is also your age of consent. Okay, your age of consent, meaning you are capable already of deciding for yourself, you are capable already for giving your consent. Okay, so class, outside, if you are not in the Philippine setting, you may support the decision of your patient. As long, class, as your patient made an informed choice. As long as your patient made an informed choice. Class, I would like again to emphasize on the word informed. When I say informed, class, that means that the patient is knowledgeable of the risk and the benefits that she's going through. Okay, again, class, the patient is knowledgeable of the risk and benefits that she is going through. That's the time, class, that you will be able to say that the patient is indeed informed to make the decisions. Okay, that's the time wherein you can say that the patient is knowledgeable about the decision that she is making. Now, if I am explaining a certain procedure to the patient, is it okay, guys, that I will just tell the patient about the benefits of the procedure and not talk about the risk? Let's say, for example, I know a specific procedure is important and helpful to the patient. Do I really need to mention the risk to the patient? Or dapat lang na benefits lang i-mention ko? What do you think? Shall it be benefits only or benefits and risk that needs to be mentioned? Hey class, again, dapat both benefits and risk. Now, sir, bakit pa ulit-ulit dyan? Because class, in the hospital setting, class, you would notice that oftentimes we only talk about the benefits of the procedure. Okay, we only talk about the benefits of the procedure. Guys, if you only talk about the benefits of the procedure, okay, the tendency kasi in the hospital, people are too busy, no time to explain a lot. Plus, if you will only talk about the benefits, the tendency is that you're giving false reassurance. You're giving false reassurance. What do I mean by that? If you will only talk about positives, it would appear class nga, okay. After the procedure, 100% okay. After the procedure, 100% no complications. And you know, and you should know as a nurse that that's not the case always. That's why, yes, very good. That's correct that you need to have the benefits and the risk of the procedure. Now, let's look at the second example. Okay. I'm so sorry. It's very small. Let's increase the size now. Baka mamaya ma-eye strain kayo dahil sa klase natin. Okay? Now, I'm talking here about somebody who has congestive heart disease, pregnant, being asked to terminate the pregnancy but wants to deliver the baby to full term despite the risk on her part. Okay? So, look at the question. Look at class the question again. So, the woman has congestive heart failure or disease, pero she's pregnant. And then the doctor is advising, hey, terminate the pregnancy. Okay, but the woman insists, I would want the child to be delivered. Now, what do you think is best here? But before you answer that question, you need to understand what is a congestive heart disease. Class, when I talk about your congestive heart disease, okay, or congestive heart failure, it would mean, class, that the heart is already failing. Okay, just think of it, that the heart is already failing. In other words, class, the heart may have had a problem. Okay, it could be a structural problem, it could be a genetic problem, it could be related to hypertension for a very long period of time, and then the patient is already experiencing complications. Now, class, we usually divide this one into 4 categories. Later on, you will know in MS that there are 4 categories for this one. Class 1, Class 2, Class 3, Class 4. Class, if you are already in the Class 3 and the Class 4, it's not recommended to get pregnant. It's not recommended to get pregnant when you are in the Class 3 or Class 4 of your congestive heart disease. Now, why is it not recommended to get pregnant? Class, if you will get pregnant and then you are a Class 3 or Class 4 congestive heart failure patient, the tendency is that you will die while giving birth to your child. The patient will die while giving birth to her child. Okay? And look at the ethical dilemma here and look at the ethical concern. The patient wants to continue with the pregnancy, but then you as a nurse understands that, who would I choose? Or the husband will think, who would I choose? Will I choose my wife or will I choose my baby? Okay? Or what needs to be done? So you need to consider a lot of factors. If I will just be following that of the woman, the wants of the woman, he would want to do it full term. And then if I would be recognizing my medical knowledge, I think it is not wise for her to do it. Okay? So what do you think will be best here? As a nurse, we should respect the patient's decision, rather incite the patient's the risk of her decision. Okay? Sir, what is the CHD class of this patient? If I would look at the scenario that's playing between 3 and 4. Yes, one here. Jane here has a point when appropriate medical care is available. Yes, that's true. Okay, those are some of the factors that you need to consider. Okay? So kita nyo guys, sometimes kasi madali lang sa aton ang balon nga. No, madali lang sabihin na, for example, I would choose the mother because the mother might be able to make another child. But then in this case, she will not be able to. And then on that case, class, the mother might ask you, no? The mother might ask you, what's the percentage that I will die on the table if I will give birth to my child? Okay? Now, with that question, as nurses, can we answer the question, or should it be the physician that will answer the question if how many percent is the tendency that he will die? Who will answer that question? That's the question for your physician. Okay? Yes, I can see the response of Jane here. Best if we offer options and let the patients decide. Okay? But again, as nurses, we are not the ones offering options. But yes, I got your point now. As long as the patient was able to see the options, okay, you allow the patient to decide and you allow the patient to talk to her husband. Okay? In cases like this, guys, you don't need to jump right away. If you will encounter cases like this in the hospital, the questions that you are throwing to me actually right now are the same questions that you should ask your patients. Okay? Or you should determine. For example, John is asking here, how far along is the baby? Maybe John is thinking, basi 2 weeks pa lang, baka 2 weeks pregnant pa lang. Okay, baka pwedeng ilaglag. Pero how about if 20 weeks pregnant na siya? Okay? You might be considering those things. So class, these questions are the same questions that you should throw to your patients and the same questions that you should try to find out to answer this one. And then, if this would happen, guys, do not rush the patient to a decision. Okay? Do not rush the patient to a decision. Allow the patient first to talk to her husband and allow the patient to weigh, as in i-weigh, timbangin ang pros and cons of the decision. Okay? The pros and cons of the decision should be made. It should be evaluated. Okay? That's one thing, no? It's not for us actually to decide. Let the mother live or no, let the child live. It's for the couples to decide. It's for the patient to decide. Okay? Now, look at this situation. I don't know if this might have happened to you, but when I was reading this from our book, I was a little bit smiling because I've heard of stories about this now. You want to pass an exam to maintain your scholarship, but then you did not study. Here comes classmate tempting you, okay, to share her answers. Now, you believe in the principle of veracity. Class, when I say veracity, it's truth telling. When I say class veracity, it's telling the truth. Yet, you also do not want to fail the summative exam and lose the scholarship. Others would say, I don't want to lose the scholarship because my parents would get disappointed. No? Sometimes that's the hugot. That's the hugot that we have. Now, if you are faced with this situation, what do you think will you do? The question here is basically cheat or not cheat. Okay? Cheat or not cheat. Okay? That's basically the question here. Okay? So some of you might, no? Okay? Very good, no? Very good responses. I would not accept the offer. I would not cheat. Okay? Not cheat. I hope that most of you will also give that answer whenever you will be faced with this situation. I hope that you will be able to give that answer if ever you will be faced of this situation. Now, class, these situations are not made up, no? These situations are not made up. These are actually situations that are being encountered in a day-to-day proceedings, no? Okay, somebody is asking, what is the financial situation if the student didn't study? What would be the long-term consequences if they fail? Yes, so those are the things now that you need to think of. And if you are this person, you should have already recognized that you have done something wrong from the start. Because if you don't want to lose your scholarship, you should be studying. Since you were not able to study, that consequence is losing of your scholarship. Okay, so this one reminds us of the principle of veracity. Okay, principle of veracity. And then class, in ethics, one of the dictum that we have is that there is no truth that would not go up. There is no truth that would not go up. In other words, guys, even if how many times will you be hiding it, somebody eventually will be able to discover it. Okay, that's one premise that we have in ethics. Okay, so I hope that you learned something from that discussion.